Greetings. My name is Kanisha Williams, and the policy I would like to implement involves nutrition promotion. Why is there a need for more nutrition policies? As we all know, childhood obesity is a growing health issue within children and adolescents. According to Center for Disease Control and Prevention, 18.4% of children ages 5 to 11 are obese. Childhood obesity is the leading cause to many other health issues like type 2 diabetes, hypertension, sleep apnea, and more. Childhood obesity is caused by the consumption of high calorie and low nutrient foods. Children are consuming high calorie foods such as fast foods, candy, baked goods, and sugar sweetened beverages. This current population is lacking the consumption of beneficial foods like fruits, vegetables, and whole grains. We have policies that are implemented to help decrease the rate of this health problem. National school lunch and breakfast programs are in place to ensure that students are receiving healthy meals in school. Nutrition education is offered in 99% of public schools within curriculum. According to Nutrition Center for Education Statistics, the course is either a concentrated health curriculum, science class, or school health program. But the intensity and quality of nutrition messages students are receiving is not known. Research has shown that 61% of schools have coordination pertaining to nutrition education. That absence of coordination leaves the teachers responsible for his or her own lesson. This raises the question of, are students really gaining any nutrition information to live healthier lives? This is where my policy can be implemented. I would like to introduce a nutrition promotion policy. The purpose of this policy is to implement nutrition promotion throughout the school buildings. This policy will require schools to present healthy eating concepts and benefits of physical activities. This can be portrayed in the form of posters and graphic visuals throughout the school building. This will grant an opportunity for teachers and students to discuss what is presented on the posters and visuals. This policy will ensure that students are gaining nutrition information outside of the traditional classroom setting. The two programs that will support the implementation of the nutrition promotion policy are Action for Healthy Kids and Team Nutrition. Action for Healthy Kids is a program that creates healthier schools by bringing members of school community together and providing them tools and resources to make change happen. Team Nutrition, an initiative of the USDA Food and Nutrition Service, supports national efforts to promote lifelong healthy food choices and physical activity by improving the nutrition practices of the child nutrition programs. There will also be a cost within implementing this policy. There will be a workshop that will be provided for teachers that may cost at least $12,000. This workshop will include learning information about the two programs. Teachers will also be trained on how to engage students in the visuals and posters that will be around the schools. The workshop will also be an opportunity for teachers to ask any questions about implementing this policy. The stakeholders will be the Parent and Teacher Association, pediatricians, and nutritionists within the community. The PTA members play an important role in the school and the children's health. They provide most options of outside foods children intake in school functions or fundraisers. Engaging them in this policy will be a helping hand with helping children live nutritious lives. Pediatricians and nutritionists are very important to engage as well because they are the main pupils in the community that are aware of the health problem at hand. Engaging them will also gain more help into implementing this policy. They will be able to provide different ways to help promote nutrition to the children. There will be 4 steps to implementing this policy. The leaders of this policy will be the teachers. Teachers will be required to take a workshop on the 2 programs that will support the policy and ways to discuss the nutrition promotions that will be around the schools. Schools and teachers will be provided with posters and visual graphics monthly to display within the school and classrooms. The following step will contain students because they will be provided with homework or more so take-home activities. The students will have healthy foods to discuss within the classroom or around the school. This part will be very similar to how students have a daily letter or shape. Instead, it will be a healthy food or a specific physical activity. This will then involve the parents. Parents will be able to discuss this information at home with students when doing the activities. These 4 steps will involve all individuals that surround the child. The implementation of this policy will provide students with information that they can use throughout their lives and push them to live healthier lifestyles. This policy will also be a resource for children to learn nutrition outside of the traditional classroom setting. Implementing the nutrition promotion policy will be a step to helping children live healthier lives. Promoting nutrition in their main environment, school, will help engage students in information they can carry throughout their lives. Let's begin the proper steps in helping our children and implement the nutrition promotion policy. Thank you.